Hello, everyone, and welcome to the first of this podcast series. On this World Patient Safety Day, I'm delighted to be speaking with Mr. Ram Khandelwal, the founder of the Heart Health India Foundation and a strong advocate for patient rights. At Access Health International, we too have been deeply engaged on the cause of patient centered care, most recently in our role as Secretariat for the Asia Pacific Cardiovascular Alliance. Through Ram's journey as a heart attack survivor at the age of 33, he has transformed a deeply personal experience into a movement for change, building India's first heart patient support group and raising awareness about CVD and amplifying the patient voice in healthcare. Good afternoon, Mr. Khandelwal, and thank you for joining us today. It's a privilege to have you speak to us about an aspect of healthcare that doesn't usually get the attention it deserves, and that is patient safety. We want to take a slightly different approach. Instead of looking at this issue purely from a perspective of healthcare providers. We want to shift the spotlight to the patient himself or herself. What does patient safety mean to a patient? And how can really an informed patient demand safe and dignified care? As someone who has turned your personal experience into a powerful voice for patients, a powerful platform for patients, I would like you to start with your personal journey. For those who don't know about it, if you can recount the life event that was the turning point for you, the creation of the Heart Health India Foundation, and how that brought about a shift in perspective on health resilience and gaps in patient support in India for you.
Thank you, Stuti, for having me here, and thank you, Access Health, for this opportunity. And I think today's theme is very pertinent and very close to my heart because, like you have said, when we talk about patient safety, most of the time we are looking at it from a systems lens or a HCP's lens.
Yes.
But a lens which comes from patient is equally important, and that gives a more holistic and wider picture. And I'm glad that we will be talking about it more in detail as we go along. So let me start, Stuti, with my own journey. Uh, so I came from a very business as usual environment, working in a corporate. I studied at one of India's leading institutions, specialized in architecture, did my infra planning, spent nearly 15 years in public sector consulting. And when I was expecting the least, at the age of 33, I collapsed in my office due to a massive heart attack. And that episode changed the whole perspective to life because it was not just an accident, it was a turning point in terms of what life is when you are living with a chronic condition. Because most would think heart attack is just an event, but it is not so. It is something deeper. It's a disease which you are living with, the coronary artery disease, and you need to learn how to live with the disease. And at the age of 33, nobody plans to have a heart attack. So with that, it changed our life upside down, and we felt that how do we move forward from here? Now, the goalpost has changed. What new life is going to be? What new normal is going to be? And in that exploration, Heart Health India Foundation was born because it was about understanding how patients take the lead or how patients lead the change. And we felt that patients need to connect with each other, patient needs to support each other, and patient need to share experiences with each other. And that became the genesis of our foundation, where we brought people together to support each other, to educate each other. And over a period of time, this small group, which started from Facebook, has become a national movement. We are now a nationwide pan-India operations organization, which brings heart patients from all over the country together to help them stay connected, learn better, be more educated about their condition, leverage each other's knowledge, leverage each other's connection, provide solidarity to each other, and then also generate a lot of new insights, new data, new research, which comes from collective patient experiences, which we have never experienced in clinical settings. So when we talk about continuum of care, this is the place where we get insights from the communities. And I think that has been our journey so far. And in this journey, we have been lucky that we have had opportunity to partner with prestigious platforms like Asia Pacific CVD Alliance, along with other global organizations like World Heart Federation, NCD Alliance, Global Heart Hub, and others. And we are amplifying our work in areas of patient education, community building, public awareness programs, and policy advocacy. So that has been our journey so far, Stuti.
Thank you. You spoke about the continuum of care. Now, even an issue like this is usually looked at from the systems lens, but it is a very critical aspect for the patient himself or herself in how easily they're able to navigate the system. So, as I understand, one of the basic you know, uh, objectives of the foundation, Heart Health India Foundation, is to really facilitate the patient journey, right? So I wanted to understand what has been the response from patients and families, and in that sense, what impact have you had so far with this? And could you share like a story from, from the support groups or campaigns that would have stayed with you personally, something that you can recollect?
Definitely. And it would be difficult to count because there are so many stories and so many individuals and so many families, but I'll certainly try to pick some examples. Uh, when patients get together, they actually ask questions which they hesitate to ask.
Hmm.
We think that we will go to our doctor for a routine checkup and we will have our questions written with us and we will get answers to them. The story doesn't end there.
Hmm.
You and I, at some point of time, would have taken care of someone in our family where we have to visit hospitals and doctors. And we realize that there are so many good things we don't know when we come back from clinics.
Yeah.
And every time we want to know, we hesitate in picking that phone and calling the doctor.
Yeah. Yeah.
And I think that's the gap which these communities are filling in today. Because these questions now people can ask freely and openly, and they don't have to live in blind spots.
Hmm.
Now they have answers to those questions. How this platform is also helping is these questions are not just answered by patients, which whose experience might vary and there might be some biases, but also doctors themselves are part of it. So wherever we need course correction, wherever we need any sort of moderation, that scientific angle is always there.
Yeah.
So just to give you some example, a couple of weeks back, a person in our community said that I was diagnosed with 90% blockages, and I've been trying this XYZ home-based remedy, and it's been 2.5 months, and now I feel good. And someone from our community responded, "Sir, feeling good doesn't mean you are doing good." Uh, Third person responded that, "Sir, what you are going through, I had gone through the same phase 10 years back, and today I am in hospital as a case of heart failure. So don't
Hmm.
make the mistake which I made."
Hmm.
And these kind of stories and insights are practical and implementable. And when people hear this real stories, real example, real life heroes, people are on a better course correction. And I think
Correct.
that's the kind of stories and that's the kind of platforms we need where we
Hmm.
do constructive community building.
Yes, yeah. Yeah, I understand because in a busy healthcare setup with a high patient load, patients, doctors rather, or service providers do not usually have the time to go into the minute details of what the patient is going through. So in that sense, the platform that you've provided for patients to come together and kind of share notes in that sense and share their experiences, I think that's commendable. In your experience, if you could, point out some of the major challenges that patients today are faced with within a healthcare setup, or even before or after that, beyond that, specifically with regards to patient safety, what would those be?
Yeah. So let me answer it in two parts, Tuti. So first I will talk about the primary prevention and then the secondary prevention. So primary prevention, I think one of the misunderstanding which most of us have, specifically in the area of non-communicable diseases, is no symptom is no disease.
Mm.
That myth needs to be broken.
Yeah.
And that is where I think most of us go wrong, because we feel that whenever something will go wrong, we will get some symptoms and we'll get to know in time. But we all know when it comes to NCDs, specifically chronic diseases, by the time the first symptom comes in, we are already at a very advanced stage of the disease. And that's where importance of screening, importance of testing is very important. So we need to bring in a culture where preventive screening is a part of our lifestyle,
Mm.
where preventive screening not just starts after something bad has happened, but something as a part of a more structured approach. Maybe
Right.
as preventive screening as part of our aligned with our schools, colleges, their timelines, wherein if you are graduating from school to college, that's the time you need to get a preventive screening done, and that becomes part of your official documentation process. You don't
Right.
have to share it with everyone, but at least that milestone has to be captured. Like you are updating your Aadhaar records, you need to update your medical records.
Right.
And things like this actually put ourselves in a position where compliance becomes a part of our preventive behavior.
Yeah.
So that's something which requires a systems approach. That's something which requires a behavioral approach. So we need to work on it from both the aspects. When it comes to secondary prevention, I think another thing which we always tend to miss is we think of our doctors as both educators as well as a person who's treating us. But we need
Mm.
to understand that maybe it's in an ideal world that will be true. But
Mm.
given the kind of patient load we have in our government and private systems, our
Right.
doctors do not have enough time to educate patients.
Right.
And patient education is important.
Right.
Somebody who's living with a chronic condition, be it cancer, be it diabetes, be it heart disease, they need to learn about that disease. They need to understand why this disease, why this medication, what are the complications, what to do in these conditions. And
Right.
this requires a structured learning process. This cannot be done just by one leaflet. This cannot be just done by a 5-minute session with a doctor, but it requires much more than that. And that's
Yeah.
where we need to start bringing in mechanisms where patient education is an ongoing part of our healthcare systems. And
Right.
not something which is optional, it is something which is important for every patient to have. And
Right.
that is how we kind of bring in communities together, which kind of blend this gap where the patient and healthcare system are trying to meet their ends. And that's where I think communities come together, where patient education becomes a fundamental layer.
Right. Right.
So I think if we are able to address these challenges, then we will have better adherence, we will have better patient outcomes, and we will have better prevention in a overall scheme of things.
Yeah, yeah. So when we look at the provider setup, and one of the first rules of any healthcare provider setup is to do no harm, right? Um, how do you look at patient safety in this context? As we know, a lot of preventable health episodes take place within the hospital itself. So, for example, hospital-acquired infections, right? Um, so keeping that in that context, rather, like how do you look at the role of patient literacy in ensuring not just patient safety, but also the knowledge that they deserve dignified care.
So it's a multi-layered question, and I think a lot of intricate and complicated things
Yeah,
attached to it. Very difficult to answer in short, but I'll
yeah,
try my best. Uh, so let me just break this down. First thing is when we say patient safety.
yeah.
So we need to understand when patients look at their safety, first and foremost, what safety means to them.
Mm,
That's the fundamental principle. And when it comes to safety, the questions which people ask generally, is this something which I'm required to do? Is this something which is optional or mandatory for me? What are the trade-offs which I have if I make this choice? And what are the risks of any externalities which may arise because of this?
mm,
And if all these questions are answered, then we get to know, get to understand in a larger sense in terms of what patient safety is.
right.
And in this entire context, I think education and consent, these are two terms which are very important because patients being non-medicos, a lot of these things, when we try to explain it to them, they're making decisions at a with a very limited set of information, with a very
Mm,
limited understanding of what they are supposed to do.
right.
Secondly, they also, so these terminologies need to be simple, these concepts need to be simpler for them to make these choices. And secondly, they also need to have a clear understanding of what is the risk that they want to bear, what is it that they are that is non-negotiable. And any hidden information needs to be given. And not
Right.
at the gunpoint, but at the consent. So
Right.
if you are telling someone that we are taking a person into a surgery and if you sign it, we will take him, otherwise we won't take him, that those decisions are gunpoint decisions, right?
Right.
Uh, so I always understand that there are medical legal issues and hospitals, doctors, they need to have safeguards and protocols. But think of it from a patient's perspective. Think of it, what if that person would be me, and if I have to give a consent where I don't have an option not to give a consent, would it really be called as consent in that case?
Yeah.
So the moment we put that lens, then maybe we will be asking this differently.
Right.
Disclosures,
Yeah.
really important. The protocols that we are following and the risk of following those protocols. So, for example, reuse of single-use medical devices.
Mm,
It's one of the issues which we see in Indian context. Disclosures are not there,
mm,
right? When it comes to patient safety, we need these disclosures.
right. Right.
And that's the kind of things we need to start bringing to the attention rather than just saying that you take the patient at your own risk. Either you sign here or you, the patient, it is your, that's not consent, that's not patient safety.
Right. Right. And have you seen things evolve in that sense from the time when, you had your own experience when you took up the cause to now? Do you see any real change in the way our hospital systems, our hospital administration look and perceive and act upon patient dignity and safety?
Certainly, I would say there's a positive change which is happening in this direction. I would not say that it's happening at an exponential rate. And the variation is very wide. So the and it's basically depending upon the market maturity. So where you will have fierce competition in those markets,
Yeah.
there you will see better performance and better quality of care.
Hmm.
Vis-a-vis where there's more monopolization, there you will see that people tend to falter upon these criterias because people know that a patient has no choice. So whether we do it good or bad, they have to come to us. So
Right.
that variation is still there, and you can clearly see that variation from top tier mega cities to tier 2, tier 3 cities. It's clearly visible that the moment you are into a smaller town, you would see that patient safety is at a higher risk. It's not being monitored. There are less protocols. The autonomy of hospitals is very high. People have very limited choice because of time constraint. In many such conditions are time constraint,
Yeah.
time
Yeah.
sensitive. So patients do not have choice. So by default, they have to depend on the local facilities, and that's where their choices become limited, and they have to face these real issues.
Right, right. And I think a lot of that also ties into the availability of, things as simple as road infrastructure. For example, in the time of emergencies. And being someone who has studied this, and, as you said, you were in the field of urban planning. From that lens, as an urban planning professional, um, how do you perceive have and I'm not talking about purely Indian cities here. I mean large cities that you would have seen. What are some of the very intentional design emphasis given to make sure that medical care, safety, access to healthcare facilities, and on the prevention bit, the access to green spaces and exercise spaces, walking spaces. How do these, sort of tie back into the whole entire patient experience in that sense? Again, a very broad question, sorry, but the issue is so broad, so you'll have to pardon me.
Yeah. So again, I'll split this into two parts. One is the
Yeah,
primary and the secondary part, because those stories are two very different stories
yeah,
generally.
yeah,
So on the primary part, I think the right now in India we have about roughly 30 to 40% of the population living in urban areas,
yeah.
and most of the NCDs that we talk about, a lot of them have risk factors which are common to our environmental risk factors or occupational risk factors. Like you've said, already mentioned that places to walk, green spaces, quality of air, and many other things, which are actually risk factors which are leading to heart disease, cancer, diabetes, and so many other chronic diseases. Now, if we are able to fix our cities and make them more walkable,
Mm,
reduce the level of pollutions, improve indoor air quality, improve ambient temperatures. These are not only the things which will help with climate friendly cities, but they will also be leading to healthy cities.
right.
And 70% of our GDP actually comes from cities. So if our workforce, which is living and working in cities, is healthier, then their productivity multiplies, our global contribution to GDP multiplies. So making investment in healthy cities
Mm,
should be a primary focus area as we move forward. When we talk about Viksit Bharat 2047,
yeah,
it can't be done with 30, 40, 50% people actually having NCDs and living with NCDs, right?
right.
We have to have a healthy population, both young, middle-aged, and old-age population, to be falling into that bracket. Secondly, coming to the secondary prevention, and just to give you a few examples, few weeks back I was in Madrid. Last year I was in London, Milan, and every day I easily used to walk 15,000 to 20,000 steps a day.
Right.
And I just don't have to do anything else. The only thing I used to do is I was just doing everything on foot, right? As
Yeah.
wherever I have to be, I would go by walking, and
Mhm.
be it meeting people, be it being places, and uh, the walkways, the quality of walking and everything is so nice that you can actually walk. And there are scientific studies done by World Heart Federation and many other organizations which tells us specific percentage risk reduction just because if you now increase the number of steps from 3,000 steps to 7,000 steps a day, and
Mm.
then 7,000 to 15,000 steps a day. On an average, in Indian society, we are hardly walking 2,000 to 2,500 steps a day.
Yeah,
This culture needs to change. This city structure need to change if we want a more healthier society.
you're right. And in terms of the access to emergency care, how does infrastructure play a vital role, and how can urban planning in that sense facilitate an easier and more seamless access to emergency care?
So, in that aspect, there are two things. One, I think we already have things like emergency care models where we are already working on hub and spoke models, which is very well established and have been working well in states like Telangana, Goa, some parts of Delhi, etc. And there are learnings from that, which I'm sure as we move ahead will be applied to a larger geographies. Now, hub and spoke model works really well because then you can do the emergency control at the spoke level, and then you have enough time to reach to the hub and get super specialty treatment in the hub. And I think it aligns very well with the urban planning systems because that's exactly the same approach which we have in transportation systems when we do hub and spoke planning models. Uh, Now, that's one part of it. The second part of it is related to access is mode of transportation. So lot of us think when we think of healthcare systems that ambulance is primary mode of transportation. If there's an emergency, call ambulance, reach to hospital. That's the standard protocol we think of. On ground, not happening. Less than 50% people actually call ambulances.
Right. Right.
50% people use their own vehicles to reach to hospital.
Right.
The reason, ambulance is not just a mode of transport. Ambulance has to be the first point of care.
Yeah.
And if my ambulance is not first of point of care, I'll just take my car and go to the hospital because I might reach a little faster than that.
You're right. Right.
And that I think that way we need to kind of strengthen our ecosystem. Our ambulances can't just be vehicles, they have to be point of care. They need to have emergency medications, they need to have emergency monitoring system, ECG devices, AED devices, etc. So that a person knows that between his home to hospital there's someone to take care of them.
Yeah. Yeah, so that kind of reinforces the fact that patient safety is not limited to hospitals alone. It goes beyond hospitals. It's about basically how people manage care at home, how they navigate systems, and how they make sure that they have timely access to support when it is most needed. But zooming out a little bit, now you've had the opportunity to represent India at various, international fora, and particularly with heart health. Um, on in these global discourses on patient-centered care, are there certain best practices that you think models that India can replicate, and vice versa? Can the world learn from some of India's patient-led initiatives? Any examples that you could think of?
So, very recently, one of the professors at Monash University, she was on a panel with me, and she gave very beautiful examples of what we are also trying to build in India, and uh, which is based on the continuum of care approach. So, once a patient is out of hospital, how do you kind of engage with the patient and keep them uh, adherent to the treatment and the medication? So they built a system in which they send regular updates, and then they have reminders for medications, for tests, for treatments, etc. Which I really like. They use a SMS based technology for that, I see in India also, I think few hospitals are now doing something of similar sort, some clinics which are basically uh, individual small initiatives in different places, but I think once we start looking at as a systems change, uh, there's a big wave of change which we can bring in secondary prevention if we start building these systems. Similar systems we have also been implementing in our own organization, where we are working with patients so that we can help them do the journey in a more seamless manner. So
Right.
that's something which we found really useful. And I think one of the things which I often talk about when I'm on international forums is India being the largest country in the world. I think whatever small we do here it become world's largest thing. So if we make a mistake, then it's world's largest mistake. If you do a good thing, it's world's largest success. That's the way our country is. And I think the way we have put together our nationwide insurance program, universal insurance coverage, it is one of the biggest examples of what a nation could achieve to give protection to its country. And that's, I think, a commendable work which has happened in our country. There will always be scope for improvement, but that universal protection, which has come under PMJY scheme, and providing basic access, blending the government and private sector using PPP models. I think all these are phenomenal success models which we have seen here. The hub and spoke model which we spoke about in low income settings, all of them are demonstrations of very successful examples, though there will always be scope for improvement. And I think that's growth mindset, that how do we do better. So
Yeah.
we will always should be doing better than what we did yesterday. But certainly, these are the things I think world takes from us when we are on these global forums.
Absolutely. So, given this growing momentum and awareness around, health promotion and prevention, do you think it's time for, that strong call to action, perhaps even at a national level, for people to not only know their rights as patients, but also demand safe and dignified care?
I would 100% agree with you on that, Stuti. And in fact, the conditions which patients face when they are in clinical settings or in hospitals, at times they lose their dignity there. Even best of the best become vulnerable in those situations and feel exploited at times, and not being able to figure out that what they are thinking as their right is not considered by as a right by the person in front of them.
Right.
And that loss of dignity, that loss of freedom of speech, that loss of being able to ask simple questions,
Yeah.
being able to clarify your doubts, these are basic patient rights, and we need to uphold these patient rights, and we need to give value to patient rights. And in this regard, I would strongly urge that a national movement, a national petition, we should bring together, which gives a stronger movement to patient rights, patient dignity, so that patient can voice their concerns without any fear. A lot of us have already been in that situation where we have had our parents or family or someone close by, we have taken them to hospital, and we feel small. We just and not just because we are vulnerable because of health, but we are incapacitated. We don't
Yeah.
need to be incapacitated.
Correct. Correct.
And in those times, we need more strength and more power, right? And these patient rights, these instruments, these national level policy reforms can actually make this a reality. And it's not just the poor, the rich are equally, or all different sects or all different geographies are equally impacted by this. So I'm 100% sure that a national movement and a national petition would definitely lay a groundwork for this.
Absolutely. And taking that forward, if I could ask you to give one, resounding message to policymakers, healthcare providers, and to patients, what would that be?
I think the first and the only message which I would say uh, b- starts with prevention. So if we are able to build systems that works on prevention, then 80% of the problem we have already solved. We need to increase investments in prevention. We need to start building systems which are uh, preventive in nature. And these can't be namesake and these can't be lopsided. It can't be public versus private. It has to work like an integrated system. And both the segments need to be equally involved and equally accountable. And we also need a lot of new players to become part of the stakeholder ecosystem because it has to be a collaborative approach. So, what has not worked, the gaps have all remained. We need to start filling those gaps to make prevention a more strategic. It requires behavioral approach. It requires systemic approach. So, all those things to come together for the only motto of prevention.
Absolutely. And lastly, Mr. Ram, what is your long-term vision for this um, invaluable platform that you've brought together? And not just that, but for overall patient safety and heart health in India, say maybe in the next 5 to 10 years, what would your vision be?
So, our eternal vision for this organization, when we started this, and 5 years down the line, even today, remains the same. No other Ram and Aditi should see what we have seen. Uh,
Right.
that remains the core principle of what we have been doing. And I think if, as a nation, we are able to achieve this, we are able to reduce the hardships for patients and their families. I think that's going to be the biggest achievement. We are working specifically in cardiovascular space, but I think that theme resonates with us, that the hardships that we see, and we can't be looking at it from a just from a provider's or a decision maker's POV. We have to look at it from a person's POV. What if this person was me? And then when we design systems, we will design it differently.
Right. Right.
So if you are a patient or a family member of a patient, and if you need any help in understanding your condition, want to connect with patients like you, want to learn how to live with a chronic condition, then please do join us our platform. Our details are available on our website www.hearthealthindia.org. If you have any questions or queries, please do write to us. We'll be more than happy to help you navigate your journey. And keep spreading the message. Stay informed, stay healthy.
Thank you so much, Mr. Ram. You are already a voice that is heard by lakhs of people, and we hope through our platform we are able to amplify it a little more. We hope that this message reaches the right audiences, the policymakers, the healthcare practitioners, and the larger patient ecosystem of not just the patient, but the caregivers in and around the patient's setting. So thank you so much for giving us your valuable time, and we look forward to keeping the association going. Thank you.
Thank you. Thank you.